The human immunodeficiency virus, HIV, continues to be a major global public health issue, having claimed more than 35 million lives to date. As this deadly virus destroys the function of cells in the immune system, the body becomes increasingly unable to fight infections and is far more vulnerable to disease. Africa is the most affected region in the world, with an estimated 5% of all Africans living with HIV AIDS, 2.3 million of whom are children under the age of 15. In 2019, across Africa, there were 440,000 deaths as a result of HIV AIDS, and nearly 1 million people were newly infected with the virus. That's one infection for every 1,000 people. There is no cure. However, effective antiretroviral drugs can control the virus and help prevent transmission, so that people with HIV and those at risk can enjoy healthy, productive lives. Between 2000 and 2018, antiretroviral therapy helped reduce new HIV infections by 37% and saved 13.6 million lives. In addition, viral suppression helps prevent transmission to others through sex, needle sharing, and from mother to child during pregnancy, birth, and breastfeeding. People living with HIV tend to be most infectious in the first few months, with some individuals experiencing flu-like symptoms, including fever, headache, rash, or sore throat. However, many experience no symptoms at all in this time and remain unaware of their status until later stages. As the infection progressively weakens the immune system, an individual can develop more serious signs, such as swollen lymph nodes, weight loss, fever, and diarrhea. Without treatment, they can also develop severe illnesses, such as cryptococcal meningitis, severe bacterial infections, various cancers, and tuberculosis, the leading cause of death among people living with HIV, accounting for around 1 in 3 AIDS-related deaths. HIV can be transmitted via the exchange of a variety of bodily fluids from infected individuals, such as blood, breast milk, semen, and vaginal secretions. Risk of infection is greatly increased by actions such as engaging in unprotected sex, sharing contaminated needles, receiving unsafe injections, blood transfusions, tissue transplants, and sustaining accidental needle injuries. Individuals cannot become infected through ordinary day-to-day contact, such as kissing, hugging, shaking hands, or sharing personal objects, food, or water. There are a number of approaches to the reduction of HIV transmission. These include correct and consistent use of condoms, testing of those exposed to any of the risk factors, as well as their partners, offering tuberculosis screening at HIV care services, initiating ART for all people living with HIV, offering pre-exposure prophylaxis, the daily use of ARV drugs to block infection, and post-exposure prophylaxis, the use of ARV drugs within 72 hours of exposure. People who inject drugs can reduce their risk of infection by using sterile equipment for each injection and not sharing drug-using equipment and drug solutions. Treatment of dependence, such as opioid substitution therapy, also help reduce the risk of transmission. HIV-positive mothers are able to pass the virus on to their child during pregnancy, labour, delivery, and breastfeeding, and rates of mother-to-child transmission can be between 15 and 45%. However, by providing both mother and baby with ARV drugs as early as possible in pregnancy and during the breastfeeding period, this transmission can be almost fully prevented. The Africa Health Organization has a strategy in place to contribute towards putting a stop to the AIDS epidemic in Africa by prioritizing HIV prevention, expanding HIV testing services, and scaling up antiretroviral therapy among all those who are at risk. With your donations, big or small, you can help Africa Health Organisation create a better Africa for all the people. Our work is funded solely by donations, so whatever you can give makes a huge difference. As little as £10 can help fund innovative new welfare projects to provide better care and practical support for children with HIV AIDS. You can donate to Africa Health Organisation on the website at aho.org/donate, by telephone on 0300 1234 055, or by using a mobile phone or tablet to scan the QR code and make a contactless donation. You can also find more information about our work and other forms of donation, such as goods and legacy wills, on our website at aho.org. Thank you.